Hello and welcome to GAPNA Chat, an official podcast of the Gerontological Advanced Practice Nurses Association. GAPNA Chat provides interviews and discussions with GAPNA leaders and members of the gerontological healthcare community, and will focus on advocacy, policy, education, professional development, research, and clinical care for older adults. In this episode, Dr. Cassandra Vonnes, a gerontological nurse practitioner and member of the GAPNA Communication Team, talks with Dr. Carolyn Clevenger. Dr. Clevenger is a nationally recognized leader in gerontological nursing and education, and is a past president of the Gerontological Advanced Practice Nurses Association. Dr. Clevenger discusses her inspiration to become a gerontological nurse, her accomplishments during her service as GAPNA President, her work on the GAPNA Leadership Institute, her leadership style and experience, and her greatest mentors and influences throughout her career. We are pleased to present Dr. Vonnes' interview with Dr. Clevenger.
Hello all, this is Cassandra Vonnes, your host for GAPNA Chat, and our guest today is Dr. Carolyn Clevenger, and she's going to share a little bit about the GAPNA Leadership Institute for us. Dr. Carolyn Clevenger is a gerontological nurse practitioner and professor and associate dean for transformative clinical practice and the community partnerships at the Nell Hodgson Woodruff School of Nursing at Emory University. She's responsible for the Office of Clinical Placement and the Emory Nursing Experience, including the Wound Ostomy Continence Nursing Education Center. She is the clinical director and a practicing nurse practitioner at the Emory Integrated Memory Care Clinic. The clinic is a nurse-led primary care practice for people living with dementia. The new model of care has been recognized as a patient-centered medical home and an age-friendly health system. The clinic boasts the extraordinarily high patient experience scores and has nearly eliminated avoidable hospitalizations for people living with dementia. Dr. Clevenger earned her BSN from West Virginia University, her MSN from Emory University, and her DNP from the Medical College of Georgia. She completed her postdoctoral fellowship at the Department of Veterans Affairs, and Dr. Clevenger is a past president of GAPNA. So, Carolyn, suppose you're having a conversation with your 20-year-old self. Why geriatric nursing?
So I, at 20, was nearly done with nursing school. I was one of those traditional nursing students. And nursing was actually not my first choice. Geriatrics was my first choice. I just wanted to work with older people. That's really where I wanted to spend my time. And I wasn't sure how to make that a reality for myself. I think I've always had this element that I'm just practical. So practically speaking, what can I do to work with these folks in a closer and more meaningful way? And I thought nursing would be a reasonable pathway to get there. So at 20, I was in my third year of nursing school, still not sold on nursing as a profession at the time, I have to say. But I knew for sure I had to get to that geriatrics piece. I was probably already looking then at graduate programs to figure out how I could go ahead and specialize, having honestly a hard time even then, finding a graduate program to become a nurse practitioner where I could just do gerontology and not have this adult gerontology business, because I did not want to water down my geriatrics education with a bunch of adult issues.
Well, you were definitely speaking to GAPNA when you looked at the watered down education. Recently, you've been a past president of GAPNA. Mm-hmm. Remembering that time, what is your proudest accomplishment during your tenure?
It was a really fantastic experience in that role. And we were doing some renovations in my office here at work. So every day I try to clean out a little bit more. And today I actually ran across 2 folders from the board meetings when I was president-elect and then the year that I was president. And I think by the time I was past president on the board, we had converted to Dropbox files. So I still have these in my office. And I thought, well, this is timely. It mostly is consistent with what I remember when I think about this. So a couple of things I would say about the GAPNA president role. First of all, I try not to get too caught up in, what was sort of my contribution or my achievement during that time, because even the way that we operate as a board, where the person in the president role is really there over this continuum of time as a president-elect to really learn how the operations of that role in that office function, and then as president, and then as past president to then mentor the incoming person. I think that even reflects the organization's philosophy about leadership and the position, not so much just the person, right? So I think the GAPNA presidency, when you look at all of the people who have fulfilled that role during their time, it's this role that's larger than one person. It feels like it's certainly larger than me and even the things that we worked on. So that particular year, we were really due for an updated strategic plan. It was time to say, what are our priorities? Let's revisit where we are. I think it had been 5 years since the last one. And so we took an additional day of our face-to-face and really spent time talking about who are our people. We thought that serving our members was really our priority. And I have to give full credit to Valerie Sable, who's such a phenomenal writer, because she came up with the exact right verb that we thought about that I think has been so far in that strategic plan as our priority, which is to delight our members. We loved that. That was a really fun one. I am from the Georgia chapter, as many people may know, and the Georgia chapter prides itself on our swag. And I still remember modeling some swag for the board because it also, I think, has been meaningful for me in other roles, including in our chapter and other groups where these are volunteer leaders who are making a commitment to the profession larger than their job, larger than their career, to try to make the overall profession a better place and be able to do more and to influence more things. And so one of the ways that's really nice to recognize that and to be grateful is to award someone with, something. And how nice is it when it's a really nice Yeti cup with GAPNA on it, or our warm pashminas? Those, I think, came out around that time. So those were kind of some fun things that we did. We were early on in the days of the pharmacology meeting. We were early on in the days developing certification. But, most of the really big contributions and initiative of GAPNA take multiple years and the entire board. So I'm always a little hesitant to say, this is my one thing. But there are some things that I was able to contribute to at the time that I'm really glad to see have continued on and grown and gone on to evolve into whole entire new things like certification boards, for example.
How did your experience craft your leadership style?
I think most all of us begin to develop that leadership style by observing the leaders that we have in front of us, all of the aspects, which is, I think, always a good reminder for me to remember that people are paying attention to the way that I am clear about vision and goals and communicate strategy and organize and problem solve at this point. I was exposed to a variety of different leaders in my mostly professional life. I probably emulate a lot of those. It was probably around the time for me here at Emory when I stepped into early leadership roles, like in an academic or a faculty role. We think about something like a course coordinator is a leader, supervisor, manager. I was a couple years into my faculty role in coordinating a 7-credit course with 10 clinical instructors and 10 lab instructors and about 110 students. I was younger than the average age of my students, certainly than many of the instructors who were working with me. There's a lot that comes with that around your own confidence and competence and how you respect the contributions of everyone on the team, because just the most simple terms, these people had more experience at both nursing and teaching than I did in terms of the instructor team. Many of them had more life experience than I did. So gathering and respecting the input of those individuals, but also then finding my place and stepping up as the leader, because when you do that, that is to the benefit of everyone else who's on the team. Early on, I think you think about leadership as being really about the individual and the person sort of stepping in and directing things. But in reality, the leader's level of competence actually makes work easier for everyone else in the organization or on the team. In the Leadership Institute, which I know we're going to talk about in a minute, one of the first topics that I like to address is what we call the leadership lid. That's the idea. And John Maxwell, I believe, has written a ton of leadership books. And he sort of created this in the 21 irrefutable laws of leadership. And the idea is that you as a leader are like an 8 out of 10. Your whole team is never going to be higher than a 7. And that's kind of the idea for why we invest in leadership development. Once I kind of got that idea intuitively, I then started really diving into reading a ton of leadership and management books. I was in a pattern for a long time, and the first cohort knows this. I was doing a nonfiction book every month. Readers are leaders, or leaders are readers, Roosevelt quote, and podcasts and online courses. I just could not get enough, because once I figured out that my leadership ability and competence actually impacted the entire team, it wasn't just about me. I got really committed to continuing to develop myself in that way. I work for someone right now. My boss is a lifelong learner, avid reader, continues to pursue her own development, whether that's with individual coaching or group coaching, or surrounding herself with other really high functioning leaders, because she always is trying to improve her own leadership abilities. So I think it's so much about those role models that I've had in my life. And then that big shift for me when I realized it just wasn't just about me and myself.
So you really stepped up to become a leader in the Leadership Institute. You're on now your third cohort. Tell us a little bit about the GAPNA Leadership Institute.
The GAPNA Leaders Institute came about as a concept. I probably was still on the board at the time and talking with other leaders, other presidents of the group. One of the things that we think is really important, which is succession planning. We used to have these days as part of our annual meeting in which committee chairs, special interest group chairs, chapter presidents would talk about what's going on in their chapter. And so you hear this, and I heard this, at least 3 years, if not longer, because I was chapter president as well before, and then I chaired a national committee before I was on the board. And you would hear some chapters really struggling with identifying, bringing in not just new members, but also supporting and developing them. And they really did not want to continue having the same people doing leadership roles, that they wanted to bring new people in. So I'm sitting here in this professional organization. I've got, of course, this faculty role, and I think about these graduates that I send out early into their career. And I know their priority when they're first starting is the safety and their minimum competence of taking care of this patient in front of you, and figuring out how to elicit a reasonable history without taking 30 minutes, and also doing it competently and being safe and, not killing anybody. Then they're really ripe and ready to be more engaged and to not just receive mentoring, but then potentially become mentors into the profession. And I just felt like there was this gap, and I wasn't alone in that. So we started talking about what this could look like for GAPNA. What does it look like to grow the next generation of leaders, not just for GAPNA, like the organization, but for the gerontological advanced practice nursing workforce, period? Because we believe that geriatrics is very clearly a specialty that requires expertise, that requires specialized knowledge, that is not something you just kind of come by. The systems and structures and models of care that serve older adults need leaders with geriatric expertise, but they also have to have this leadership skill set. So we started thinking about, what would it look like to do something like this? How would we pull in a cohort every year and really engage them and support their leadership development in a fairly intensive environment? And we came up with the Leaders Institute and created this as a 12-month, although I think some years, look, we're still living through the pandemic. So there's some flexibility, I think, around how long that goes on. The group has a couple of different components. There's this sort of larger curriculum that is really directed by the person who's the lead faculty. The person who's lead faculty has so far been a past president of GAPNA. That's sort of the intent. Although in theory, you could have someone who just would need to understand a national nursing organization at a pretty high level. That might actually be a very reasonable thing. But at this point, it's always been a GAPNA president. I think that's where we're headed for the foreseeable future. And there are objectives, there are program outcomes that we expect that the fellows, that's what we call the learners, the fellows then achieve over the year. But the faculty, true to academic freedom, because this is my environment, have some leeway in how they decide to meet those outcomes. So if, for example, one of the competencies is around communication, there are so many different ways to address leader communication and professional communication. I've been myself the beneficiary of a leadership academy across the health sciences here at Emory. And so one of the things I always remember from my academy was doing elevator speeches, and everyone, there was draw your name out of a hat or some kind of rotation that you on the spot had to give a 60-second elevator speech, and the group critiqued it, right? And these are also leaders. So you could do that, a million different ways. So the lead faculty sort of gets to decide how they cover it, what they want to focus on, what readings they think are relevant, all those sort of prep. And that content happens monthly. And that's where the whole group comes together. It's synchronous. It has always been over Zoom or an online platform. That's always been the intent. So no shift there over the last couple of years. And it happens usually on a Saturday morning. We've been doing 10 a.m. for our West Coast friends who like to get up early. The first year we ran it, we were at 10 a.m. I'm a 7 a.m. person, right? Like I'm a 5 a.m. workout person. But unfortunately, the West Coast people were more like they would have preferred the 10 a.m. Like if we could have flipped, it would have worked great. But anyway, we all sort of made it work. We grabbed our coffee. We sat in cars while kids were on soccer fields. We all made it work, came together for that month. And the fellows are there. The lead faculty is there. Most of the time, the mentors are there. The thing that happens, though, outside of those monthly sessions, other than a little bit of preparation for the monthly session, like some readings or maybe a video, is that fellows meet with their mentor on a closer basis because fellows are completing not just this didactic or this curriculum on leadership, they're also putting some of that into action through a project. And the project is they work closely with the mentor to both identify, often pare down the project to something that's reasonable, and then help them kind of implement and evaluate it and get that ready for whatever way it's going to be presented at the end, depending on the individual fellow's career goals. Where there are fellows who are academics, and so publication would be really meaningful to them for their career goals. We have some folks who are fully on the service side in industry. And so a poster at conference might be relevant to them, or a podium presentation, or an executive summary that their supervisor or their leadership team would want to see. So whatever that product looks like, we sort of work with them. That's what happens over that year. There's, a fair amount of engagement. I don't think it's overwhelming. I think it's been so far in the first two cohorts a pretty manageable outside of work kind of commitment. People have, I think, hopefully gotten quite a bit out of it in terms of their own career and professional development.
So in addition to the readings and the online interactive, what are some other requirements for the fellows in the Institute?
In a typical year, we would say they need to attend in person, but it's been a mix of in person or online. Annual conference. What we had intended was we would kick off each year at annual conference. We were able to do that this past year in 21. The annual conference, everyone was there together. And you do some introductions, maybe sort of prep what's going to happen in the first session. And then at the pharmacology, it's around mid-year. So it's a good time to sort of touch base again to see each other face to face. And so if we're able to do pharmacology again in person, I'm anticipating, and people are allowed to travel and all of that, there is some stipend support for fellows for both of those expectations. But it is typical, like you would expect that someone will have been engaged in the organization in the past. Most of the time that they've been at conferences before, they've maybe participated in their chapter, for example. That usually helps quite a bit as they start into the Leaders Institute.
Who should apply? At what stage in your career would you be thinking about an application?
This is interesting. So one of the things we've talked about, it comes up every year in the Leaders Institute so far. Okay, both years. We talk about when people got sort of their first role as a formal leader and how they ended up in that position. And so often what we find is that someone who maybe they look up to, someone who's been a role model for them, maybe even a peer, sort of taps them on the shoulder to say, hey, that Leaders Institute? Hey, that next program director? Hey, that manager position is open. I think you'd be really good for it. You should apply. So let me just say, you can apply yourself. And if you're someone who is maybe not necessarily ready, or maybe you are a fairly senior leader and you identify someone in your professional circle, I cannot overestimate the value of someone doing that. It can be really life-changing for someone. I think we don't realize those small comments when we, just say that to someone, what a difference it can make. I ended up being an assistant dean because a former student who was working at the school saw the position was open, sent me a text to say, I saw that position was open. I think you should go for it. I think you'd be great at it. And I had never even considered applying. So let me say that you can recommend people. And in fact, the last 2 years, the application process has been by recommendation and referral. If you are someone who's been recognized by GAPNA as a rising star in the past, you are definitely someone who should be considering doing the Leaders Institute next. We have had people who are maybe in their first manager role where they now are supervising people and haven't necessarily had direct reports as a manager before. That's a really great time. We have had people who have not yet been placed in a formal manager role, but they see that as their career trajectory. The person I'm thinking of first, who was in that sort of position and would say, we're talking about like managing people and some HR things. And she was like, well, I haven't done this yet, but this is so interesting. I hadn't even considered these things, graduate of the Institute, now managing people. If you are seeing that as part of your career trajectory, it's not that you need to wait until you're in a formal supervising sort of role. But if that's where you want to head in your career, it's probably a good time. To me, at least a few years sort of where you're comfortable in practice and with your workflow, whatever that practice is, whether it's education, direct patient care, or so forth, I think probably a good time to do that. But yeah, don't wait. And if you think of someone, if you're hearing this podcast and you're thinking of someone in your circle who'd welcome this opportunity to get some more in-depth development and would be really engaged and interested, even a quick word, a text, an email, a call, encourage them, please.
You've shared a lot about your personal experiences developing as a leader. Who had the greatest influence on you, if you had to think back from where you are now?
Gosh, there's so many. Two that I'm going to mention. I have a mentor. I've worked with him. I think I was still in my GNP program. So this since 2006. I don't even know how I quite decided this one's going to be my mentor, but I really had my eye on him. He was coming to Atlanta from another part of the country, not a nurse, but really seasoned in gerontology and was doing all of the things that I wanted to be able to do, when I grew up. I still remember finding him at a national conference. It happened to be the Gerontological Society of America, or GSA. And I found him in the poster session and I was like, Dr. Hepburn, I'm Carolyn Clevenger. I know you're coming to Emory. I'm there. Listen, I looked like I was 12, but I was on the search committee. And so I was like, I would really like to, connect with you. And I was like, that's going to be my mentor. He has been such a phenomenal mentor because of those opportunities where he would say, this is coming available. You should consider it and I'll help you do it. Here's some people that I want you to meet and you make sure to connect me. We still enjoy, I think, a pretty good mentoring relationship at this point. Anyway, we've been through a good bit together and just invaluable. So that's Ken Hepburn, and he's a gerontologist. And like I said, not a nurse, but an incredible grantsman and really passionate about dementia family caregivers. And, half of my work right now is focused on dementia family caregivers. Of course, the other half is on dementia patients. The other is the person I work for right now. I've worked for my current dean, Linda McCauley, for, I think she's probably been here 9 years. I'm on my 18th year. So it's been a minute for me, but because I've worked so closely with her and I've watched her leadership style, she is a very confident and assertive nurse in many rooms where she's the only nurse. And I think just watching her advocate, there have been many times as just that role modeling piece for me. And I've said this to her and publicly. Later on in my career, became associate dean for partnerships. And so I was in rooms with lots of suits, lots of healthcare folks, not academics and not nurses. So, 90% female over here. So I'm like a bunch of men in suits. And this is just a really new space for me. Just sort of watching the way that she manages a room like that, it was very empowering for me. So I thought, I don't need to hesitate to speak up. I don't need to be euphemistic in the way I'm speaking. I'm in the South, so a lot of euphemisms, a lot of talking around things. I can be really direct, really assertive, and just be very pointed in what I'm saying. And I'm confident because I was really nice to remember, like, I don't work for them. I work for her, and she'd probably be thrilled if she knew I was here speaking out. I have excellent access to her. So that's really important for my team. I make sure they have really good access to me. When I need resourced, when I need direction, opportunities that I maybe can't see for myself, she makes sure those happen for me. So then that's exactly how I treat my team. So it's really been interesting. She's not the only dean that I've worked with, but I've worked with her certainly the longest and the closest. And she's a force. Just tons of respect for her. And I have learned mountains of things sitting close to her and learning.
I want to thank you so much for taking time out of your day to share your passion about gerontologic nursing and leadership and development. What's next in your next chapter?
People end up being interested in leadership roles because they want to see change. So you go, okay, I think things should be different. And then ultimately, if you really want it to be different, then you're going to need to be part of the solution. And that's the laudable thing. There's nothing wrong with that. But then don't underestimate the fact that then you need skills to make change happen successfully. And that's where your own development comes in. And, it's part of nursing, right? Nurses are lifelong learners. And we see that as a core value. For me, I've been learning all of that leadership and management reading has also kind of shifted into business development and really doing some interesting things with our clinical practice here. You mentioned the nurse-led primary care practice. It's the only nurse-led primary care practice in this very large health system. It's the only practice of its kind across the country so far, and we're about to open a couple of new models of care as well, all focused around the care of people with dementia. Really having, I think, a good time with figuring out running not just a practice, but a business.
Thank you again, and just keep that joy in your job. Certainly pass that on. This is Cassandra Vonnes saying goodbye for now, and again, thanking Dr. Carolyn Clevenger.
Thank you for having me.
GAPNA Chat is owned and produced by the Gerontological Advanced Practice Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. Dr. Carolyn Clevenger is a gerontological nurse practitioner, professor, and associate dean for the clinical and community partnerships at the Nell Hodgson Woodruff School of Nursing at Emory University in Atlanta, Georgia. She is responsible for the Office of Clinical Placement and the Emory Nursing Experience, including the Wound Ostomy Continence Nursing Education Center. She is the clinical director and a practicing nurse practitioner at the Emory Integrated Memory Care Clinic. She completed her postdoctoral fellowship at the Department of Veterans Affairs. Dr. Clevenger is a past president of the Gerontological Advanced Practice Nurses Association and a fellow of the American Association of Nurse Practitioners and the Gerontology Society of America. Dr. Cassandra Vonnes is the Nurses Improving Care for Health System Elders Coordinator, Geriatric Oncology at the Moffitt Center in Tampa, Florida. She is a member of the Gerontological Advanced Practice Nurses Association Communication Team and is a host of the GAPNA Chat podcast series. For archived episodes of GAPNA Chat and to learn more about the Gerontological Advanced Practice Nurses Association, visit gapna.org. You can also subscribe to GAPNA Chat on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found.